again for being here. Okay. So my talk today will, as Don said, it's based on the research I've been conducted so far, which focuses on the use of virtual reality in neuropsychological assessment and in rehabilitation. Before we start, I'll just give an overview of today's talk. So I will be starting saying a few words about my background. Then I will discuss the main aspects of doing using virtual reality in clinical psychology, and present the main results of my research and what research we are conducting these days after the pandemic. Fingers crossed, won't restrict us. A few words about my background. I've started doing research with virtual reality in 2012, so it's been almost 10 years. I've been a research fellow at the UE in the Department of Psychology and Bristol Robotics Lab, and I'm a lecturer at the University of Bath. I've been playing around, as I like to say, with lots of nice environments, nice virtual reality environments like the simulator, the Flourish simulator, and also the virtual reality lab from the University of Bath. As I'll present later, there are various types of use of virtual reality in psychology and in clinical psychology, but my research so far has focused on the use of virtual reality technology in the assessment and rehabilitation of cognitive processes. In general, when we speak about cognitive processes, I will refer to processes like memory, like attention, visual-spatial analysis. I've worked with lots of various VR platforms and various populations. Let's say the first environment which I've worked is the one in the middle. It's called the virtual classroom, which simulates a real classroom in virtual reality, where children are assessed in an environment that is very similar to the environment they perform in everyday situation, like a classroom environment, and they are assessed. Their attention is being assessed in this virtual classroom. Another environment which I've worked with is this one in the left side, which is a virtual apartment in a cave environment, where people, it's a cave environment. It's a type of virtual reality environment where there are four projectors which project and compose an image of a place, in this case an apartment, and here the participants had to navigate in the virtual environment and learn as many items as they can in a limited session of time, and at the end their performance was assessed. And one of the most recent environments I've worked with is the one on the right side of the screen, which is a virtual aquarium, where people had to attend and look at a certain species of fish that come in that are appear on the screen, and they have to follow some rules and attend to respond to specific stimuli. But I'll come to this later. So I've been working with various types of VR platforms, and which I present some of the results later on today. I'll just try. Okay. So in general, when we discuss about virtual reality technology, a simple definition is virtual reality is an advanced human-computer interface which generates, this is the most important part, a three-dimensional environment and uses a wide range of technologies such as trackers and head-mounted displays, headphones, and joystick, which allows the person to immerse in the virtual environment, and he will actually feel as he's part of that environment. That's the key point. And the key features of virtual reality, as most people recognize, is the Oculus headset, which looks like like a pair of glass that is able to deliver the computer generated environment, and the body trackers and the tracking technology allows the virtual environment and the technology to capture the people, the participants' movement, and allows the participant to control the virtual environment via the trackers. Probably, I know virtual reality is currently a hot topic, and maybe it's a pertinent question to ask: why should we use virtual reality? What are the benefits of using virtual reality? The first and most important is that virtual reality is able to generate realistic or imaginary environments and to deliver them in a space, a safe and controlled space. So most importantly, when people, let's say, the most important aspect is the safety. If we think about some people that are different, for some people it might be difficult to place them and invite them to cross a street or visit a supermarket. And it is usually safer to recreate a virtual environment like a shopping center and place the person in that environment, and they can practice and navigate in that environment and interact with different objects in a safe and controlled space, instead of going in a shopping mall. This is the main benefit of using virtual reality. It is really realistic, and not only it's realistic, it can allow the people to explore in a safe manner the environment. That is one of the reasons why virtual reality is currently being used for training programs where real-life training would be dangerous or very difficult to simulate. So here are classical examples. It's firefighting, it's also space training, driving of autonomous vehicles, like I've previously done at UWI. We were inviting older adults to have a go and ride in an autonomous vehicle and interact with the driverless car system while simulating the virtual experience. Also, virtual reality was used in surgery, training surgery, and medical procedures. So it's a wide range of applications, but the focus on today's topic and my research is in clinical psychology, more specifically in neuropsychological assessment and rehabilitation. Just a flavor of what's being currently done in virtual reality in clinical psychology. Some people, as we can see here, and it's probably a hot topic, it's the PTA, it's treating phobias or treating post-traumatic stress disorder. This is one field in which researchers are creating the virtual environments and exposing people to their stimuli, the stimuli that create a fear response in virtual reality. Also, some are using virtual reality as distraction therapy, in which people that suffer from pain, they are exposed to different types of environment and they distract themselves during a painful procedures. Below we can see again a virtual classroom in which children are being tested in highly ecological environments instead of being evaluated on a piece of paper. So there are lots of virtual environments that are being used in clinical psychology. As I think I said earlier, its main advantage is the ecological validity, which means that if ideally us as psychologists and as researchers, what we aim to do is during our assessment procedures, we want to make sure that what we evaluate has also ecological validity, which means that the results we obtain during an evaluation, during assessment, have to predict the performance people have in real life. So this is the aim. So we want to have tools that can predict as accurate as possible a performance in real life. So this is ecological validity. And virtual reality, because of its ability to recreate realistic experiences, has the potential to offer increased ecological validity. Also, virtual reality has the potential to become and be a very cost-effective tool for delivering psychological treatments. Again, it can sound it can be expensive to develop the whole environment and therapy per se, but after this, it has the potential to be accessible to a wide range of people. It can increase accessibility because the treatment will be available on various computers. It can be less costly than a one-on-one intervention. And for people that have difficulties accessing one-on-one treatments, it can be easier or more accessible to interact via a virtual reality system. And as we will see, it is effective in neuropsychological assessment and in rehabilitation. I will now present some main results from my previous research. First, I will talk about virtual reality in assessment, and afterwards I will discuss about virtual reality in rehabilitation of cognitive processes. So the first question, this was done part of my PhD studies. The main question was, are virtual reality measures sensitive in detecting cognitive impairment? Before I start, it's just a general, I'll just offer some general brief overview of what neuropsychological assessment is. So usually we as psychologists use tests to try and identify whether someone, let's say, has to assess the level of cognitive functioning. So to assess the level of memory, the level of mental flexibility, the level of executive functioning and attention. Usually this is being currently done using, as we call, classical tests, which include paper and pencil tests or computerized tests. These tests are were being criticized because some say that they lack ecological validity, which means that we cannot rely 100%, well, 100, there's not always 100% in research or in science. So their level of predicting real life functioning, and as discussed earlier, is moderate. So what we want to find, to identify or to have tools that are being able to predict in a greater sense the performance in real life. So how a person can perform in real life. And because the classical measures are thought to be to predict only moderately for real life performance, we're looking for other tools that can have a higher predictive value. And here we have the virtual reality. So here, as we can see, there are some images of classical paper and pencil or computerized tests. The one with the squares is called Corsi blocks test, and it's a classical computerized test that measures visuospatial short-term analysis, in which during the test some squares lighten up, and the participant has to learn very fast the way the squares light up and reproduce it. The other one is another classical test, trail making test, with the one with the numbers, where people have to connect the circles in ascending order as quickly as possible. So these are examples, and the other one, the one with the red, green, and blue, are a classical test. One of the most widely used tests is the Stroop test that measures attention and executive functioning, and people have to respond to the squares, to the colors, following a specific rule. These are examples of the classical tests, computerized, as I said, and paper and pencil. And some say that the tests are obsolete because they were developed sometimes in the middle of the 20th century, so 1950s, around that period, and they say, okay, they don't have great ecological validity, and their Bay principles are rather old compared to what currently the challenges in the 21st century are. So that's why advocates are suggesting virtual reality might be the answer and might offer a more ecological validity. So this is just a general overview, so help us frame the question better, hopefully. So the question is, are virtual reality based measures sensitive in detecting cognitive impairment? Results from a meta-analysis of 16 studies, and it was before part of my PhD studies, showed that indeed virtual reality has a moderate level of sensitivity in detecting abnormal cognitive functioning. So what we said, its level of sensitivity is similar to established classical papers, but it's not superior. So no evidence was found. The meta-analysis was done in 2016, so newer studies were published. So I'll probably have to update this meta-analysis, but based on the 16 studies published by that time, the virtual reality is similar to established tests, but it's still not superior. However, when we look at the specific conditions that were evaluated, we can see that it had increased sensitivity for detecting cognitive deficits that are linked with brain injury and ADHD compared to other conditions such as schizophrenia. So in conclusion, based on this, we can say that, okay, researchers and clinicians can use virtual reality measures to assess cognitive deficits. with, however, saying that it's as good as the traditional tests. Now, a second question that was also intrigued us is if virtual reality tests are more difficult than traditional tests. So because virtual reality recreates an environment in which people perform daily, like an office or a virtual classroom, some say a hypothesis was that virtual reality requires additional cognitive resources compared to the traditional test, in which, as seen earlier, you need to, let's say, just remember and circle some, follow a line, or just remember how some squares light up and reproduce it. Performing in virtual reality can be more challenging because you're immersed in a virtual environment and you have all sorts of stimuli that you need to attend besides the one that you're required to focus on and to answer, which might make virtual reality more difficult than the traditional tests. And we wanted to see if this is the case or not. Indeed, what we saw, it's again a meta-analysis based on 15 studies. Results showed that yes, the hypothesis is true, but only for executive functions and visual spatial analysis, but not for memory. So for memory, there were mixed results, and apparently memory performance was actually enhanced in virtual reality. So we ask ourselves why is this the case? And as the literature also suggests, the fact that in virtual reality, while you have to learn, of course, it's the type of memory we are testing. In the studies included were mainly object locations and types of objects. And in virtual reality, as we said, it's probably the fact that the images are more vivid, are more lively, it makes them easier to be learned in virtual reality. And also, if participants navigate, it's also coupled with the motor performance, which also can enhance performance in virtual reality. So the bottom line would be that, yes, overall, VR is more difficult. However, one size does not fit all, so we need to be careful, and we need to look at specific functions that are either enhanced or performance decreased in virtual reality. And also what results showed, as it's pretty intuitive, is the fact that distractors can impact negatively the cognitive performance, which means, so in everyday life we most certainly encounter distractors. If we are in a shopping center, or we are at the supermarket and we want to pay, or we want to remember what to buy, we have distractors. We have people running around, or we can hear some music, or we can hear all sorts of people coming through us. So our memory or our performance might be impacted negatively by the distractors. And yes, as in probably in real life, in virtual reality, distractors negatively impacted the cognitive performance, which again allows us to come back to the first issue, that virtual reality requires additional cognitive resources, and because it recreates a more realistic environment. And taken together, all the results suggest that indeed virtual reality is able to successfully recreate a realistic experience, and it might benefit people if they learn something in virtual reality or if they perform in virtual reality, because the performance is resembles closely to the challenges they have to face in real life than in a testing situation in a laboratory where they have to fill in paper and pencil questionnaires or computerized tests. Now, this is a very recent, it was before COVID, just before COVID started, this experiment was finished. So the main question was, again, if virtual reality can detect cognitive impairments that are associated with depression and anxiety. What I would like to do is, before we start, when we refer to with cognitive impairments can be present in a wide range of conditions, clinical conditions. They can be present in children with ADHD, for example, like attention deficit. We can have cognitive deficits in stroke, in Alzheimer's disease, in mild cognitive impairment, in brain injury, and also in psychiatric conditions as well, like in depression and anxiety. Of course, the level of impairments are a continuum, ranging from high to low, but research has shown that in depression, in anxiety, there is some cognitive impairment, which we wanted to see if virtual reality is better in detecting these cognitive impairments. This study is called an exploratory study, and it was done in partnership with colleagues from Explora Technology and Behavior from Spain, and colleagues from Romania. Here is it's a mock-up photo of the virtual system we've used, and you can see the virtual reality headset, which was Gear VR, and on the computer desktop we can see what the participant actually saw in the headset. I'll say a few words about the virtual environment. So this is, of course, the resolution is better on the headset. This was pretty, the quality is not that good here. It's actually a print screen. Here we can see, this is the virtual aquarium, and attention performance here was measured using a continuous performance test paradigm, which is one of the most established, one of the most widely used and established measure of attention. During the test, the participants is virtually positioned in the main room of a virtual aquarium, and during the task, the participants has to pay attention to the main fish tank, and between the two rocks, different species of fish pass at high speed. And the task is, whenever a certain species of fish, like the clownfish, passes through, they should respond as quickly as possible, and they should ignore other species of fish like the clownfish. Or this was the visual condition, and we also had an auditory condition in which the fish were heard in the speakers, and the participant had, again, when they heard the clownfish, to respond as quickly as possible and inhibit the responses to any other types of fish. So this was the setup and the task itself. The key results, we included participants with low and elevated symptoms of depression and anxiety. And performance in virtual reality was positively associated with classic measures of attention and inhibitions, which tells us that indeed the test, the virtual aquarium test, measured attention and inhibition. And even so, it predicted elevated symptoms of depression and anxiety above and beyond the traditional cognitive measures. So it was better than the classical tests. We also collected some data about the safety of VR, and we had no adverse effects. No one felt sick after being exposed in VR. So all good news for virtual reality. So in conclusion, this was the topic, the main topic on virtual reality in assessment. So overall, what the research data shows us so far is that for some conditions, virtual reality is as good as, and for some condition is even better. But of course, we don't have a black or white. We're still collecting data. We're still looking for other evidence that points in the one direction or in the other. But today, this is what data suggests. Now I will move on and discuss virtual reality in rehabilitation. I will again start with general question and present some results from meta-analysis and quantitative data synthesis based on meta-analysis, and then just present some main idea research from our current research. Again, now in rehabilitation, what's important is we want to see if virtual reality is effective in improving cognitive functions or functional outcomes. And the main question is, okay, can virtual reality, in this in assessment it was, can virtual reality detect impairments? Now we want to ask ourselves, we want to ask whether virtual reality can reduce impairments now and improve overall functions. What the data synthesis from 41 meta-analysis showed for people with brain injury, stroke, and cerebral palsy was that indeed virtual reality can be effective. We included studies that used various interventions that were designed to improve physical or cognitive functioning, like reinforced feedback, treadmill training, but again adjusted in virtual reality. So we compared this with with control groups that were following classical interventions. And we also included virtual studies that used various virtual reality devices, fully immersive or less immersive. In virtual reality, when we discuss the technology, there is some categories are fully immersive, which is the HMDs, which are the classical headsets with the glasses. They are called head-mount fully immersive because when people are placed glasses, they are immersed in the virtual world, and there's no contact with the outside world, which can improve the sense of belonging and being in the environment. And some link fully immersive virtual reality with better transferable. So immersive virtual reality, one can accumulate and transfer the skills acquired from immersive virtual reality better to real life tasks, because they're actually being in the environment, and the level of interaction it's greater than in less immersive environments, which are classical screen type technology, where people attend and see the environment, but they're actually not quite there. So it's not the resemblance with the real world is less present. So what the data, what the results of this showed us is that, as I said earlier, indeed virtual reality is effective in improving physical and cognitive outcomes in people with stroke, with brain injury, and children with cerebral palsy. However, we have to be cautious because the studies that were included in terms of their study quality they were read the data, the study quality was quite low or very low, which means that we are not very confident in the results. So as a cautious, maybe design future studies with better quality. So this is just a cautious note. When we look, we also looked if we use customized VR systems compared to especially with commercial systems, we could see that customized systems produce greater effects, which means, put it simply, is that if researchers develop a virtual system and probably apply the neurological learning principles, that will have better effects, better outcomes than if one uses gaming consoles. So usually why we refer for gaming, so commercial systems are usually the ones that are available on the market. It's like the Microsoft Kinect or the Sony PlayStation, where people can buy the system. It's like the Wii Sports, where people can play various games on the consoles, like Wii Sports, skiing, tennis, and so on, which are considered and some use and they're being used as a potential medium for improving physical and cognitive outcomes among various populations, including stroke and brain injury and children with cerebral palsy. The benefits, the advantages of using the systems is the fact that they are available on the market, they are easily used, they have easy the interfaces are pretty easy to handle. So yes, they have effects, but however, if we have the ability to customize and adapt the systems to the specific problem or to the specific function we want to rehabilitate, seems to produce larger effects. However, most studies, in conclusion, most studies do not address the safety concerns, as only 9 out of 41 reviews reported adverse effects. However, all the data from the 9 studies show that virtual reality, immersive or non-immersive, is safe, so it doesn't produce any nausea, no falls, nothing, so it's safe. But again, it's based on the results from only 9 studies, and we don't know about the other 40, the rest from the 41 studies. So it's best to just pay attention to these variables as well. This is the last meta-analysis I'll present today. It focuses now on the efficacy of virtual reality in rehabilitation of mild cognitive impairment and dementia, which are again conditions that are characterized by decrease or limitation in cognitive functioning and in physical function. We will focus here on cognitive functioning. We included 16 studies with people with mild cognitive impairment and 4 studies people with dementia. I'll have to, before presenting the results, I have to say that this meta-analysis was conducted by my PhD student from the university, Themis, and it's being currently, it's under review in a journal Journal of Alzheimer's Disease. And in this study, we included both immersive and non-immersive virtual reality technology. Results are promising. So for mild cognitive impairment, we found significant improvements compared to classical treatments. We found positive improvements in global cognition, in attention, in memory, in construction and motor performance, and in the quality of life. So lots of variables that were positively impacted by VR interventions. And for dementia, we found positive effects on global cognition, memory, and executive functioning. In conclusion, we can say that research supports the use of virtual reality in the assessment and rehabilitation of cognitive functions among various populations with cognitive difficulties. But this is, of course, a general conclusion. We have to look careful on the type of the condition we are studying, and of course the type of virtual reality platform we are using. And as I prefer to say, one size does not fit all. So to have the best effects, we need to be still tailor the intervention to individual characteristics, and also tailor the characteristics of the virtual reality intervention and the virtual reality platform we are using to the specific audience, let's say, because in the meta-analysis of Themis, the meta-analysis Themis has conducted, she also observed that she also looked at whether immersive virtual reality, so the one with the headset, is better than the traditional, the less immersive, like the desktop or the gaming consoles. And what she actually found out was that for people with mild cognitive impairment, we did not have data for dementia. So for people with mild cognitive impairment, performance was actually better in the less immersive environment, the less immersive platforms, than in the immersive one, which probably explains that people with mild cognitive impairment might find it more difficult to interact with the virtual reality system. So that's why their performance is decreased, as we can link it with past research with the one that said that virtual reality is more difficult than the traditional test. So this is just a general overview, because we can go into less details, but I think that would be my general is that the fact that one size does not fit all, so we need to be very specific to tailor the intervention to have the greatest effect. We also have some ongoing research now at the university, as the pandemic allows us to start the testing. We are currently, my PhD student is conducting the study of memory performance in virtual reality. And we are looking for healthy younger and older volunteers if you want to take part into the study. I will now show you just a brief video on how what we have in how the virtual environment looks like. I'll now exit my share screen, and I'll enable the other screen. Just one moment. I'll just share my screen, and now I should be able to see my video. Now start recording.
dogs! Get your hot dogs!
Okay. This is the environment we are currently using, and if you are interested in taking part, you can contact my PhD student Temis, and we would be really happy if you want to take part. What we're looking at, I don't want to spoil everything. We are looking at ways in which we can identify whether any particular characteristics of the virtual environment can enhance memory performance, and if we identify whether certain characteristics of the virtual environment improve better performance, then we can use and identify the specific characteristics of the environment and use it to design interventions that can enhance memory performance. So if you are interested, please contact Temis, and we would be more than happy if you want to join. So this is, yes, thank you for being here, and I'm more than happy to answer any questions. Thank you.
Well, thank you very much, Alexandra, for a most interesting talk about virtual reality in assessment and rehabilitation. So really interesting to hear about the latest research that you've done. We've got quite a few questions in the chat room. I'm just going to enable people now to unmute themselves and also to start their video if they so wish to. Let me just do that. Yes, so we'll start the Q&A session now, and then please feel free to unmute and to show your video if you want to. I've come initially to Duncan McGibbon. Duncan, do you want to unmute? Because you've got quite a lengthy question, so rather than me reading it out, it might be worthwhile you asking it in person.
Okay, just a second. I've got to find it in chat. Right. Right. Thank you very much for this fascinating talk, Alexandra. It was tremendous listening to it. I can understand the place of VR in getting public acceptance of things such as connected autonomous vehicles, especially in new health technology. But though diagnosis might improve, is VR any more effective as a treatment for the affliction of mental health problems than previous virtual realities, such as mimesis and catharsis and psychoanalysis, or the alternative virtual realities of drug therapy and electrotherapy and group simulation?
Okay, thank you. Thank you for your question. So technically, you're asking if VR is better than the established treatments, or?
Sorry?
Is it better than the established? We're talking about, the question was for rehabilitation, virtual reality.
Yes, I wanted to emphasize the fact that alternative reality has been a feature of the treatment of mental illness since the 19th century, because that's what Freud wanted to introduce with his idea of catharsis and mimesis. And when I was young, the idea of drug therapy was very much put forward as being yet again an alternative reality in which the patient could recreate, etc., etc.
Yeah, thank you. So so technically, I think here if we go, we can discuss of psychotherapy in general, and it depends, of course, on the type of psychotherapy paradigm we want is following. So I think in the Freud one, it's a dynamic in which we want to recreate during the psychotherapy process. We want to recreate some of the initial relationships that the person had during the childhood, and I think the therapist wants to recreate the experiences in which the person can give different meanings, and this is indeed a type of psychotherapy. What VR was done in it follows, it's important and it's evidence-based in the treatment. If we go and follow the cognitive behavior therapy paradigm, in which mainly, how do you treat the phobia of someone? Well, you try and expose the person to the stimuli that frightens them. So if, let's say, one has a flight phobia, how do you treat it? Well, you basically try and put the person in a plane. Well, of course, gradually, or you just, it depends. Again, these are details, but you try and expose the person to the stimuli that frightens them. And in turn, they will see, okay, it's not that bad. So they will adjust their reactions. So this is where VR works, in this type of paradigm, where instead of, going with the person in an actual plane or in an airport, what do? You just recreate the environment. You put the glasses, you're in a safe environment with your therapist. You can control the amount of stimuli, or if you want, if the emotional experience is too powerful, you can just stop the simulation and discuss your reactions, which has, of course, it's cheaper, it's more safer, and you can repeat it a couple of times with your therapist before you go in real life. So that would be, in long story short, it works in the cognitive behavior therapy,
okay,
and not in the dynamic one or experiential one.
Yep,
Psychotherapy.
Great answer. Thank you very much.
Thank you, Alexandra. Another question is, how will virtual reality assessment develop as the VR technology improves to give a more high-quality, lifelike experience?
Okay, that's challenging. So my guess is as it will become more realistic, and it will become more accessible, it's still so, even if there are lots of studies that have been done, it's still room for some more. What we see so far is that there's only one virtual reality test that it's in Spain that has data and can be used as a clinical tool. So in psychological tests, what one needs to do, even if we discuss about intelligence and memory and attention, in order for them to get out of the lab and be used in clinical practice, we need to gather lots of real life data. So we need to test, thousands of people, so that we will know, okay, that if you score 100, what does the 100 mean? So this is psychological measurement theory. In order to get VR out of the lab, we still need to gather lots of data, test thousands of people, and then we can say, okay, we can use it in private practice. So I think this would be the first step, is just gathering the data.
Yep.
And of course, we still need powerful environments. It's still, I do hope now that as the technology progresses, the quality of the environments will become better. And now with, I think the paradigm shift occurred starting with 2015 when the Oculus and all the advanced virtual reality are commercialized, because previously there were huge headsets, they were difficult, they were less immersive. Now I think that the prices drop, so people can afford to buy the headsets for their personal use. And I think Facebook has also, the Meta, they want to push forward. Yeah. And probably the pandemic in general, they're looking for live environments and yeah.
Okay, no, that's great. Thank you, Alexandra. There's another question. I know that Trevor's going to ask a question because he's shown his video, so he'll no doubt ask a question very soon. Before he does, I'm just going to go to Fernando in the chat room. He says, "Can you please tell us a little bit more about the types of adverse effects?"
Yes. So in general, what we say about the adverse effects is what we mostly fear in virtual reality is the fact that it's the simulator sickness or cyber sickness. The simulator sickness is similar to motion sickness, and we want to avoid. It usually because it's a stimulus mismatch. So the symptoms are similar to those of motion sickness, like it's fatigue, it's nausea, it's dizziness, which can lead to falls, and we just don't want that. Usually the symptoms are transient. It's like motion sickness. It will pass, but again, we don't want to have people that can fail and avoid things. So this is what we mean by adverse effects. It's mostly linked with simulator sickness. Ways to avoid it. So the theory is that it's a is a stimulus mismatch, which means that let's say you're sitting on a chair and you're in a car and the car is moving and the brain doesn't know how to integrate the conflictory information. On one hand, okay, visually I'm moving, while the proprioceptive symptoms say, okay, we're not moving, and this can cause the sickness. It's not major, but we want to avoid. Usually, some say that some people are, let's say, wired to experience severe symptoms. Yeah. It's usually those that have motion sickness. And for those, we in our lab, we do not test. We have some screening questions and we ask whether they experience severe. So it's a red flag if they say they do. Some say, on the other hand, that as you will expose yourself more and more to the environment, the brain will get used and you won't get any severe symptoms. So it depends, but probably just screen and avoid placing people in such situations.
Okay, thank you, Alexandra. Fernando, you've sort of shown your video. Did that answer your question? You're on mute at the moment, Fernando, but I assume
I'm sorry.
No, that's okay. Did he answer your question?
It's typical that I forgot the.
Yeah, that's fine. Did that answer your question? Yeah.
Yes, I just want to tell also or ask another question. A short question is regarding people that are with the senses more augmented. How can we avoid this kind of effects also regarding these people that, have these senses augmented?
Yes. So again, probably avoid so they are, as we say, have a good quality of the virtual environment. If you have the headset, you need to make sure that the image is not blurry. So make sure that if it's blurry, it's highly likely that you will develop. Also, limit the exploration time and try and not take quick turns. So just have a smooth ride if you walk, or it's better to just sit and instead of walking. So try and not have sudden movements. So I think we can also have the room, a cool room temperature could also help. So it's just little things that can also reduce the negative effects. And the most important thing, if you do experience, just don't stay, remove the headset and take it from. But again, and also don't try and get up, because you might fall. So if you experience, just take it and don't try and relax and then walk or get up to the chair.
Okay, thank you very much. Trevor has been very patient, so over to Trevor to ask his question. You're still mute, Trevor.
I'm always very patient. Andrea, thank you very much. That's really a fascinating talk. And my question really goes on from the last question of these feelings of motion sickness and things. But it's a bit more basic than that, because virtual reality experience is still, for many people, a new experience. And for many people, maybe old people, a new experience, having that headset on, etc., etc. This, of course, must have an effect on your results. So what do you do to try and overcome that? Do people get trained on virtual reality, or do you eliminate certain things? Because it's very dependent on people's reactions. I can imagine someone with anxiety, for example, being either fascinated by what they're seeing or frightened by what they're seeing. You've got to overcome this, presumably, in your assessment of the results.
Yes, indeed. So what we usually do, so we offer participants an initial warm-up session, which means that, again, it's they can explore and navigate in the environment. They learn how to use the controllers and play around in the environment, which is, of course, it's a similar but not identical environment in which they will have to perform. So that's probably what we do. We also ask initially other basic questions regarding the experience with the systems and with the technology. But yes, we offer them. So we don't train. It depends, of course, on the type of the expert. But technically, we train on how to use the system, to familiarize yourself with the system, and practice as many times as you want before actually performing in virtual reality. I do hope this clarifies your question.
Mm-hmm.
Yes, but technically, even if so, when we're, let's say, testing older people, we assume that we sample people, and the samples of participants we have will be representative to the whole. But again, we can't say that it's in psychological studies we don't have the ideal sample, because it's a self-selected sample, because only people that are interested will come to the research.
Yes.
So they're not 100% representative, but we can't force anyone to come.
Yes, for sure.
Okay, well, I mean, we're out of questions in the chat room, and unless anybody wants to ask any more questions, then before I tell you a little bit more about what's happening in the coming months, maybe we can all unmute ourselves and give Alexandra a round of applause for tonight's very interesting talk. So well done.
I'm not on video.
Very good. And also, before I tell you what's going to happen in the next couple of months, don't forget, you can earn yourself £10 an hour to become a participant in the study. So I'm sure that you may have noted down the email address to contact. So
yeah, I can type it in the chat.
If you wouldn't mind putting it in the chat room, Alexandra, because not only can you find out about virtual reality, you can also earn money from it. So it's a win-win situation. And let me just talk briefly about what's coming up in the months to come. In April, we've got Lorraine Whitmarsh, MBE, from the University of Bath, giving a talk on the psychology of climate change action. So that's in April. In May, we have got Jason Koenig from Bristol University giving a talk on epistemology and decision theory. And then in June, we have a talk by Karim Ismail, who's been with us before. He's giving a lecture on Wittgenstein. So those are the next 3 months, April, May, and June. You will have just seen the message by Alexandra in terms of the email address. So I'll give you a couple more seconds to write that down. And I hope it gives you a flavor for the philosophy program to come. And whilst everybody is just noting it down, I also would like to tell you that we have just recruited Professor A.C. Grayling to come back to us this year, and he's giving a lecture on the 6th of December at the end of the year, and very much related to the state of the world at the moment, and philosophically what that potentially means for the future. So that should be a very, very interesting lecture in December, and Don and I are fleshing out the program for the rest of the year as we speak. Don, is there anything else you want to say?
Only to say, to remind people if they're not on the newsletter list to put their email address to you on the chat.
Yeah. So I mean, I've already seeded that in the chat room earlier. We've got a couple of email addresses that have come in, so I think that's fine. But in the meantime, please have a look at the BLSI website for all the forthcoming talks, not just for philosophy and psychology, but for all the other different interest groups. So, Alexandra, once again, thank you very, very much for your time. I know Alexandra has recently become a mum for the first time. So she's waiting to get back to her husband and her little boy.
I didn't know what I signed for when I said that I just came back from maternity leave after 6 months. So thank you.
Yeah, so all the very best in your new family.
Thank you very much. Thank you. If you have any questions or anything, my email address, I'll just type it
in there as well.
Or of course, you can find me on the Bath Uni portal.
Yeah, so it's av561@bath.ac.uk. Good. Well, listen.
Thank you all for having me. It was
absolutely. It's been an absolute pleasure. And as I always end these talks nowadays, I look forward to seeing you in April. And in the meantime, stay safe, stay healthy, and most importantly of all, stay sane. Good night, everybody.
Thank you. Bye. Bye.
Bye-bye.